What is gut leak syndrome?
Yes. So gut leak syndrome, it is nothing but a very common thing which come across in our children with developmental issues. So gut is intestine or the whole intestinal system it's called. Leak means it's leakage, something there is a leakage in the pipe that way. And syndrome is a set of symptoms arising due to gut leak. So what happens is usually in our body, so whatever we consume, see we take food in the form of carbohydrates, proteins, fat, different minerals, everything. So everything needs to be absorbed from the intestine through the bloodstream which goes close along with the intestine, and the blood will pass to the heart and everything transmitted from the heart to every organ for supply of nutrients. So commonly this happen in every body, but in kids with developmental issues, right from autism to Down syndrome to every kind of developmental issues, there comes this gut leak syndrome. So usually the intestine is made up of cells. See, every body part is made up of cells. So the intestinal wall is also made up of cells. So the millions of cells will have gap junctions between each and every cell. Each and every cell will have a very minute gap, unseen by eyes, can see only through a microscope. But this gap should be very even and very tiny. When this gap junctions are little enlarged, so what happen is those things which need not pass from the intestine to the bloodstream, they can also pass through the intestine to the bloodstream, and hence from the bloodstream it can go to the heart and get pumped to the whole organs including the brain, where every problem arises in our children. So brain is where the sensory processing happens, brain is where learning happens, memory, logical thinking, everything's happen in the brain. Speech, writing, reading, play, everything happens there. Emotional development, yes. So when you give a wrong fuel to a vehicle, what happens? The same way, when you put up a wrong fuel in your child's body, so naturally what happens is the cells gets little diverge, okay, the gaps between every cell, so they get enlarged, so that what happens is not only the nutrients or vitamins alone will go through the gap junctions, big molecules like bacterial toxins, certain heavy metals like mercury, aluminum, lead, arsenic, they can even go, and whatever the undigested food particles. So our children will have certain lag in the digestive enzymes from the liver or in the pancreas. They call lipase, amylase, which are to digest the food what we eat. So undigested food particles and even the remains of the parasites or different kind of chemicals which need not enter the bloodstream, they will pass through and they will cause lot of inflammation finally in the brain where learning happens. So inflammation, once it happens, naturally the function of the brain gets disrupted. So naturally sensory processing gets problem, learning gets trouble.
What is yeast overgrowth and imbalance in gut bacteria?
So yeast overgrowth. Yeast is nothing but commonly called fungus. So in our children who are with developmental issues, so what happens is commonly very common thing called Candida albicans. That's a very common fungus. So that is very favorable to grow in the intestinal wall. So the reason behind is again the gut leak syndrome I've told you. So due to lot of gap junctions and lot of other favorable factors, the fungus grows more and more in the gut system, and this fungus will create lot of toxins, and these toxins, when it goes to the bloodstream, naturally the body finds it as a foreign body and the body naturally react to it, and finally there comes a disruption of the regular balance of the system in the bloodstream, as well as it affects the brain finally because of the toxins overload. So yeast overgrowth is very commonly present right from birth, and it's not something purely started by the diet. But what we can do regarding yeast overgrowth is we can cut down on the high starch foods and high sugary items, the very high oily or deep fried items, okay, which are the real food behind the fungus overgrowth. So through that way, we can surely control that yeast overgrowth, and we can surely get rid of the symptoms arising through yeast overgrowth. So yeast overgrowth can cause a lot of symptoms like self-excitement, self-laughter, anxiety, a part of mood changes like sudden low moods, crying spells, part of phobia, and even restless, swimming, running, jumping, everything comes under the symptoms of yeast overgrowth.
What is the difference between good and bad bacteria?
So, in our body, naturally, we have millions of bacteria present in almost the whole part of the body, and the most of them lies in the gastrointestinal system, the small intestine as well as the large intestine. The very principal thing dealing with kids with developmental issues is that the small intestine will have lot of probiotics and dysbiotic bacteria. So probiotics are something called the good bacteria, which are doing a great favor to us in digestion of food particles and taking the energy properly, and in breaking down certain energy and giving us the real proper way of doing things, and even it helps in creating enzymes for digestion, as well as it helps in immunity, preventing us from lot of diseases around, and even it helps in secreting certain hormones, which is very commonly called serotonin, the happy hormone, which is not in an adequate way in kids in kids with development issues. So naturally, it has lot of functions to do. The good bacteria will have many functions to absorb vitamins, minerals, so to deal with hormones, everything. On the other side, the bad bacteria, something called the dysbiotic bacteria. So dysbiotic bacteria, it should not be present beyond a limit. So when it's present beyond the presence of the good bacteria, naturally there is an imbalance happening. The good bacteria are less and they are unable to fight back the bad bacteria. Naturally there is a imbalance which causes lot of symptoms in the children with developmental issues. Principally, common things are hyperactivity, inattention, naturally to deal with unproductive behaviors like running around, jumping, and a lot of gut issues like flatulence, then constipation, not passing poop in a proper time, or not every day. They go once in a week, or certain children they go once in 2 days. So different kind of issues arises due to the lack of good bacteria and more of bad bacteria in our body. So that's very important when it comes to the gut health, and we need to remediate it through lot of interventions, and that is also done by the diet intervention.
You mentioned about mitochondrial dysfunction. Can you explain how it is relevant to kids with development issues?
Yes. So, mitochondrial dysfunction is something to do with energy production in our body. So, mitochondria is present in every cell of our body, and principally we speak about the mitochondria of the brain cells. So, mitochondria is nothing but it's the energy generator or the energy producer in every cell of a body. So, we need a productive energy flow to run any activity, right, from walking to jumping to learning things, to do any activity. But in kids with developmental issues, naturally the mitochondria will not function in a proper way. They will be dysfunctional in the sense they don't get the right fuel to function in a proper way and in a sustained way. So this lies a very major reason why the children cannot sit in a place for a long time and in a good posture. The child gets easily fatigued, the child have a poor muscle tone, the child gets easily distracted, and the child cannot complete any task in a proper way. So naturally, this mitochondria deals with the proper energy flow, and if it's not properly present, the things get disrupted, the child's functional independence gets down, even when it comes to memory, when it comes to play, comes to social development, comes to natural learning of sport, in every way. The child gets disproportionate energy in accordance with the child's developmental age. So that is the reason why mitochondrial dysfunction is very important, and this too gets corrected properly with a good diet intervention.
What kind of behaviors will you connect with the food intervention?
Yes. So food intervention is directly connected with almost every symptom of the child, right from running, jumping, poor eye contact, poor impulse response, even sleep issues, anxiety, phobia, etc. So diet intervention, it is very clearly different foods are connected in different ways to that particular symptom. Certain foods, when you ingest, it can immediately show the symptom, and certain foods taken after a few hours or even after a day, it can show some symptom. So finally, what we need to learn is almost most of the symptoms the child have, like visual seeking, auditory seeking, or seeking for proprioception or vestibular. So the common terms like getting pressure, a tight hug, teeth grinding, or spitting, or difficulty in munching, chewing, every part of the sensory dysfunction area, almost everything is connected to different foods. And in particular, sitting tolerance, which is very essential for a child, as well as social eye contact and name call response, particularly necessary. Everything gets disrupted due to the food intolerance. That is the taking of wrong fuel.
What are the most strictly no foods among these?
Yes. So as I've told, like almost most of the foods to avoid, and some foods to be given, those are good. But still, there is a very clear and very common allergy. What commonly said is, one is gluten, that is wheat and wheat products. Totally no, at least for a minimum of 3 months to 6 months, based on the child. And the next thing is milk. See, you can give curd or buttermilk or even ghee to most of the kids, but milk as such not to be added in any of the foods. So that's strictly no for a minimum of 3 weeks. They say the antibodies will go away, but strictly for at least 3 to 6 months. And in addition, white sugar, that's a refined sugar, it's totally no, and deep fry, totally no, and even the table salt is also total no for minimum of 3 months to maximum of even 1 year. Yes. So among all other foods.
How long we need to continue the diet?
Yes. So it depends on different child's level of development, the progress rate, as well as the age of the kid, and in accordance with how frequent and how regular they are to the occupational therapy, dealing with sense integration and neurodevelopmental therapy, behavior therapy, everything put together. And in addition, the parental efforts of the home program, everything put together. Yeah. So simply in common, we say like we can follow the diet for minimum of 3 months to a part of 6 months or to the maximum of 1 year, as per the rate of progress of the child and as per the sensory integration process is happening in the child within the brain, and in addition with the behavior therapies and cognitive way of therapies, everything put together. So food as such, its influence on the behavior, we need to have a clear track, and we'll deal it in that way. So minimum of 3 months to a part of 1 year, that's a very common time frame, and it's nowhere to be scary, like it's for the whole life. As per the parental question, they usually ask, they need to follow for a very long time? No. And very basically, how strenuous we give OT, naturally the liberty of the diet intervention will surely go off. Yeah, we can surely liberate on diet as per the OT to be very strenuous.
How quick can we observe changes in kids' behavior with diet intervention?
Yes. So diet intervention can show changes even on the same day, along with the therapy starter, that is reflex integration or sensory integration, a certain part of sensory input we have given. So everything put together, the right from the start of OT. The diet intervention starts even on the first day, or it takes a week or a month maximum to start showing the progress, and it keeps following in the right track along with the therapy. Nowhere there will be a flaw here and there, everything goes in the proper way, integrated.
Can you explain what is reflex integration therapy?
Yes. So reflex integration therapy, it's called a primitive reflex therapy, or we call it as primitive reflexes and postural reflexes. So the reflexes are part of the child's development. So primitive reflexes are something to do with early life, maybe the first year of life. The reflexes starts even developing right from the child within the uterus of the mother. Yeah. So certain reflexes, for example, thumb sucking is one part of reflex. A newborn baby sucks the thumb. Another reflex, an easy example is a grasp reflex. A child starts grasping your finger or any object you given, but still the child cannot voluntarily take off. You need to just take off. So these two are very common, the basic examples you can easily understand. So reflex integration. So certain reflexes need to be present until a part of age. For example, 1.5 years or 2 years. It needs to start at right time and need to end at the right time. It's not ending, it's integrating. So involuntary movements, for example, a child grasp reflex. Okay, so that need to be present for a part of secure reasons, for bonding, to hold mother. That's part of the child's development right at birth to a few months. But if it's persisting beyond, for example, 5 years, the child cannot hold the pencil properly. The child cannot attain a functional tripod grasp for proper writing. The child cannot hold a spoon properly to eat. The child cannot catch and throw a ball, and there are certain reflexes problematic. For example, we say as asymmetric tonic neck reflex, symmetric tonic neck reflex, tonic labyrinthine reflex. There are around 20 to 25 reflexes significant. So in this, there will be few reflexes affected in each child, and we need to check and we need to deal with it to integrate to become a part of development.
What is the significance of primitive reflex in kids with development issues?
Yes. So primitive reflexes are part of every child's development. So typically, certain reflexes need to start at the right age and integrate in the particular age. So reflexes are something involuntary movements, and these involuntary movements, for example, when you put a finger, the child grasps your finger but never leaves it voluntarily. We need to grab it. So this is one example I can easily explain you. So this involuntary movement should become voluntary movement very soon, so that the child can be free to use the fingers freely, independent of each other, to do any activity like writing, eating, catching through a ball, every way. But still, if that reflex is inhibited or it's disintegrated, it's not mature, the child cannot do a function. Wherever the child touch anything, the child will simply hold. The child cannot manipulate any utensil. The child cannot do any play with the hands. So here comes the significance of reflex maturity. So when reflexes mature, naturally the involuntary movements becomes voluntary movement, and the child starts developing in a functional independent way.
How can we test for primitive reflex?
Yes. So primitive reflexes can be tested by an expert therapist in reflex integration, by any occupational therapist, yeah, by even other therapists, even pediatricians, professionals who deal with pediatrics in special. So primitive reflexes can be tested clinically in the presence of child. The therapist administers different kind of, for example, a stroke, for example, a rooting reflex we usually call. Just by a stroke, if the child is turning to the side, for example, then you can easily say, okay, the rooting reflex is not yet mature, it's not integrated. So that disrupts lot of functions, even speech to different criteria, lot of dysfunctions along with that immaturity of reflex. So same way, when as I said, so when you give a grasp, like when you rub the palm from in, naturally if the child grab your finger, and this signifies the grasp reflex is immature. It affects with handwriting, affects with all hand functions, in and manipulation skills, fine motor skills, to do with every functional independence of the child. So in this way, we'll have reflex testing for every reflexes. So in the presence of child, in a quiet way, we'll just go along everything and we'll grade it in a system, in a numerical system, how far the child is mature in that particular sense, whether the child has got the reflex, that whether the reflex has started and reflex is retained and reflex is not yet mature or integrated. So we'll grade it in different way, and we'll review the same thing after following reflex integration therapy for few months, and we'll review the same thing and we'll see progress of each reflex. Okay, how far it has improved, and in accordance with that, so the significance of the development which was affected due to that reflex also gets mature and getting independent.
What is to be done when reflex are retained?
Yes. So when the reflexes are retained, naturally you will see lot of issues in the children, right from gross motor development, like the child even gets trouble to start walking at the right age, talking at the right age, interaction with peers, play development, academic way, reading, writing. So every part of development gets interrupted. So naturally, the child's retained reflexes needs to be very clearly taken away, because as you know, like reflex integration is the very base even before sensory integration, because it happens in the brain stem, the real bridge between the spinal cord and the brain. So when you treat the reflexes which are retained in a proper way, only then the sensory integration input, whatever you give to your body in the way of touch, pressure, movement to the whole body parts. So everything can enter only if these retained reflexes are mastered, when they are integrated, and this in turn give rise to the development of all the retained functional patterns like gross motor, fine motor, speech development, biting, chewing, munching, spitting, blowing, kind of every oromotor skills, and even child's emotional development, play development, everything gets better very quickly. So to master these retained reflexes, we need to give say we need to give reflex therapy in a very strenuous way. Certain things it will be like a part of points, certain points we need to manipulate, we need to just stimulate, and certain postures and certain movements in accordance with different reflexes which are retained. So, for example, just being an elephant pose, it's a very good thing for certain reflexes to get integrated. Part of jumping jacks and part of stride jumps, certain animal walks like bear walk or crab walk or a duck walk, a simple one leg standing, bow and arrow posture this way. So everything is part of the retained reflexes integration therapy. So there are specific techniques for each and everything. So which we can have a separate discussion, which is a very detailed topic. The reflex integration therapy is, yes.
Is there any restriction of reflex integration therapy with age?
So overall, reflex integration therapy doesn't have any restriction. Even adults who are getting a stroke, so-called cerebrovascular accident, or those who go to a coma kind of thing, any kind of traumatic brain injury kind of adults also, reflex therapy helps a lot to bring back the development. Yeah, so there is no restriction of age as per the retained reflex therapy. Yeah, so for kids, it's not a very great deal to work on, irrespective of age. So we have seen lot of progress even in kids of age around 18 to 21 years also. Yeah, within a week or two, they'll give us a good feedback. My child is able to concentrate more, get more attention span, sitting tolerance, more of listening, more of calm down, more of easy learning, memory kind of things we have observed very easily. A sitting posture for a particular time. So, a lot of feedbacks even within 2 to 3 weeks. But again, yes, when done along with sensory integration and other respective approaches required.
What are the alarming signs that a parent has to look for to start early invention of ASD, ADHD, or speech delay?
Yes. So, in brief, I would like to share some part of tips or kind of certain illustration like very common saying like a child will speak only around 5 years because the family it's very common. Every child speaks late or my child is intelligent in most of the ways. My child knows to say 1, 2, 3 alphabets and a lot of rhymes. Or my child is very good at singing. Lot of excuses, but the child never have started answering his or her name or even the basic part of speech also. Very common belief system is that yeah, my child knows to sing rhyme, my child knows to recite numbers. So it doesn't mean my child started speaking. So it should be very clear what is speech and what is part of intelligence or the intelligence quotient. Yeah, that differs a lot. So due to lot of other factors, social causes, it's a part of stigma. It's a shy kind of thing to bring child out just because he's having developmental issue. Maybe the society may just look at my child in a different way, or they may separate my child. So lot of beliefs. So they are part of delay in bringing the child to therapy. So it's always not a mistake to just screen any child in case of any kind of sign. For example, a little bit of thing in 3 months, a child should have a social smile, looking at the mother and give a warm smile in reply to the mother's face reaction. A simple, very simple tip. And so around 6 months to 8 months, the child need to babble for sure, at least a part of babbling, not a word, but simple babbling at least it should be there. And with a meaning, a good eye contact, and a very good socialization thing, and a basic imitation when it comes near the first year of life. So very, very basic common things we need to observe all time. And it's always good to bring the child as early, even before year. We have come across certain kids of age around 9 months. They started with the therapy. The child gets discharged within 1.5 to 2 years. The very basic reason is the early bringing of the child. The brain is very delicate. We can easily mold it. The dietary factors never create any problem. Sensory integration works very quick. Reflex integration matures so quick. So everything matters a lot. And the other tip I want to suggest you is that you need to work so well along with your therapist. Be very friendly. Get to know more details about your kid. Get to know what home programs I need to follow, because it's not just your therapy time. The clinic alone matters for your child's improvement. You need to work out a lot of home programs. You need to do a lot of efforts at your home as per your timings. You need to allot some quality time with your child. It's not I am spending 3 or 4 hours with my child, but you are not with your child. Simply placed along with your child, but you are not working anything. So even it's half an hour, but what is the quality time you spend with your child every day? So that matters a lot in upbringing your child very quick. So and a part of firm kindness attitude, firm as well as kind. That's the right word to say. So certain behaviors we need to correct at the right time in the way of positive reinforcement, as well as you need to take away certain reinforcements at the right time so that that behavior is learned in a proper way. So as a team, along with your therapist as well as family members, everyone put together, you can have a great success, because we have seen a lot of parents work so hard They have even took long leave, father and mother. They split their schedules properly for the betterment of the child, and finally they got a very quick discharge. And they are doing so well in the mainstream schools without even a sign of disorder at the beginning. So you can surely work out more positive. So never get into any kind of negative thoughts. Don't refer much into the internet, or don't just go off with your own decisions, and don't take suggestions from other parents without any idea, because every child is specific and every child is very different. You cannot compare one child with a development issue with another child. They are very unique. So one part of therapy won't work exactly for the other kids. So be very specific. Always you discuss with your therapist or the medical professionals who serve your kid. So believe in them. Just give good hope. Have positive effort. There is good positives at your progress. So work hard. Have a very good success. Thank you.
Do subscribe and share with parents if you like our video.